So it's my privilege to be welcoming you on behalf of the O'Brien Institute and the Department of Community Health Sciences today. I'd like to open by acknowledging that the University of Calgary is on the traditional territories of the people of the Treaty 7 region in southern Alberta, which includes the Blackfoot Confederacy comprising of the Siksika, Pekainai, and Kainai First Nations, as well as the Tsuut'ina First Nation and the Stoney Nakoda, which includes the Chiniki, Bearspaw, and Wesley First Nations. The city of Calgary is also home to the Métis Nation of Alberta Region 3. And the image that we selected for today is the beautiful mural that you will have walked under or observed as you walked towards this room. It's just out and to the left. It's a new addition here at the school. And for me, it's just breathtaking and a place where I can go and reflect on sort of what it means to be on these lands. So our plan today is really to get you guys engaged. It's been a while since we've gathered, and we're all excited to sort of be together. We have our online audience, we have those of you who are in the room. And what we're going to do is, O'Brien is first going to kick off and talk through some of the elements of their strategic plan, just reorienting you to where it is. It might have been a while since you looked at it. And then Fabiola and myself are going to talk you through the Community Health Sciences strategic and action plan. And then we want to hear from you. So we're going to open it up. We've got a World Cafe kind of style set up outside, and we'll have two parallel conversations running, one in the virtual room and one in the physical plane. So we're really excited. I hope you have lots of great questions and ideas that you've brought with you today. And with that, I will invite Tom up to the podium.
Great, thanks, Fiona. It's really nice to be here. This is one of the first seminars I've done in person now for almost 2 years. And I suspect for many of you as well that you've been living largely in a virtual world, at least professionally. And so it's nice to actually start remembering that we're three-dimensional beings and not some sort of avatars that exist in a computer space. And it's funny because I'm reading the book Ready Player One right now, which is actually pretty interesting. But as I read it, I think to myself, is this science fiction or is this real? And it's a little bit disconcerting. I'm just going to spend a couple of minutes just briefly showcasing a few elements of the Institute for you. I'm going to pass it off then to Katrina and to Jamie to speak about it as well. Just so you have a little bit of a sense about the Institute. So the first thing is just to recognize that we are one of 7 institutes. So there's a research institute ecosystem here at the University of Calgary within the Cummings School of Medicine. Most of the institutes are either disease, organ, or population based. The O'Brien Institute for Public Health is really the only institute that I would say really has about a 30,000 foot view. And that's kind of our niches of thinking about both how healthcare is delivered, as well as thinking about broader population health. And all these institutes are complementary, and it's important to remember. We're a massive institute. So we've got over 500 members and then over 500 trainees and highly qualified personnel who are affiliated with those members. About half of them come or have primary appointments in the Cummings School of Medicine. You can see there on the screen, that big red slice. About a fifth come from other faculties, 9 other faculties or schools across the university, from arts to science to engineering to nursing. We've got about a fifth that are primarily affiliated with Alberta Health Services, a lot of our decision makers. And then we've got 2 small slivers up there. We've got a small number that are from government or NGOs. And then a small number of our members are actually from other universities across the country, as far away as Dalhousie. When Fiona said that we're going to give you an update on our strategic plan, I can imagine people like starting to nod off. It's so exciting. So I'm going to keep this to just like one slide and then a couple of a little bit about strategy. So the first thing, what are we about? Our mission is to advance public health through research excellence. So that means that when we think about where we invest our resources and time, we ask 2 questions. Is it related to research excellence and is it related to public health? It's got to be yes to both, right? That's the intersection we work at. And then all of you do that work, right? So then what does the Institute add? Well, what the Institute really adds is it serves as a vehicle basically to support you in tackling big public health problems, right? Primarily by trying to help you come together with other stakeholders in the system for collective action. That's really what our role is. When we think about what this looks like, this is our strategy. It's super simple. This is my high resolution graphic you can see. We aim to function in the middle of those 2 circles at the interface. So the interface of academia and society. And then we do two things. If we face inwards to the university, our job is to grow our people, right? And so Jamie's going to tell you about the services of the Institute and what we can then do to help people grow. And then we face outwards. Basically, it's all about knowledge exchange. How do we facilitate interactions between societal members, stakeholders, whether that's Alberta Health Services, Alberta Health, whether it's citizens and our researchers, to basically make sure that our researchers are aware what are the primary big societal challenges around health and healthcare delivery, and that they work with stakeholders to address them, and that those then solutions get implemented. We've got 4 strategic goals. And so this image is designed to highlight that we are not trying to boil the ocean. It's a massive institute that covers population health and health systems. You know, we've got tremendous diversity of strengths and interests amongst our members, and we're trying to organize ourselves into 4 goals. And I'm going to just share with you 2 before I hand it over to Katrina. The first goal is better healthcare. That's a massive goal. So we say that our goal is to transform healthcare so that sustainable, high quality healthcare is available to all people. It's fundamentally what we're trying to support our health system researchers to do. And within that, there's 2 areas of focus. The first is learning healthcare systems. So how do we then basically help systems learn from the care they provide to patients and families and improve on that in a iterative, rapid cycle fashion? And the second is digital health. Something that, you know, was kind of really, I think in some ways leapt forward in the last 2 years, where we've been sort of forced into much more digital health. And yet what is still stunning is for any of you that actually use healthcare, you know, I saw my family doctor yesterday for the first time in person in 3 years, I think, is how far behind we are from a digital perspective relative to the fact that while I was in Toronto last week, I could do all kinds of online banking to make sure that our accounts didn't dip below 0. So those are 2 of our areas of focus. The second area of a focus is thought leadership. And our goal here is to help you solve complex public health challenges with great ideas and resolve. That's pretty big and nebulous. 3 areas of focus within that. One is we launched a Center for Health Policy at the end of June that we're in the process of sort of building up. The notion being that we really want our members to engage in work that not only advances academia, advances their career, but also that knowledge is then used to better society. And policy is one of the vehicles for that. Knowledge exchange, which has largely been coordinated by our communications team, so facilitating, bringing you together with societal members. And the last one, which we have just started to think about, is how do we foster an innovation ecosystem? So we recognize the value of academic outputs. The university has signed on to DORA, which sort of to highlight the notion that impact is beyond traditional grants and publications, right? And so how do we also foster a system or an ecosystem where innovation is easier for you and we can have an impact? So those are the 2 of the 4 goals that I want to highlight. And now I'm going to pass it on to Katrina, who's going to tell you about healthier populations.
Hi, everybody. Okay, so healthier populations is also a very big goal. And so this is the area of the strategic plan that I have oversight for. And we're doing lots of things in this area. And I think the two big pieces of work are around equity, health equity, and prevention. And so a really tangible piece of this work is the creation of a health equity hub. And so it's tangible because we can sort of put parameters around it. We can build some structure around what is health equity, how do we achieve health equity? And in our thinking, inequity is really at the root of the issues or the barriers that populations face in their, in their search for access to good care. And so when we create a health equity hub, and if you join us at a round table after this conversation, we're going to talk about what that means and what that could look like. It is still very much in development, but it really is about bringing in researchers who have an interest in structural barriers, vulnerability, anti-racism and discrimination, gender and sex work, queer theory, critical race theory. So all the ways in which people experience structural barriers. And if we do really good research, from that structural or systems level, it will bring us to a place of understanding equity and how we flip inequity into equity. And so that's one piece of the work. The other piece is around prevention, which is nebulous for everyone. What do we mean when we say prevention? But in my thinking, I think if we do a really good job understanding the root causes of health inequity through equity-based work, we actually will be doing prevention work. And so excited about that. Lots more work to do there, but hopefully we can have a couple conversations from your perspectives as well that will help us in our thinking. And so just really quickly, some of our team are here. You've met Tom and myself, and we have Jamie here, and you probably have seen Leslie. Leslie's here, but she's also on our slides as well. So Dr. Kirsten Feist is the other Associate Scientific Director who oversees health systems, the health systems goal. Mine is healthier populations, hers is health systems. Leslie is the glue, and without Leslie, the whole thing would completely fall apart. Ignacio helps us with our finances, which also is critically important because without that, we are in big trouble. And then we have a couple of rock stars on our communications and events planning team, Brittany and Angela, both of whom have been with us for quite a while now. So an excellent team. And hopefully if you're students, if you're trainees over the course of your time here, you will get to know all of us a lot better. So really quickly, our organizational enablers. So these are the things that we strive for. These are the things that we work towards. And these are the things that our stakeholders told us we should be focusing on. We did a very comprehensive process to develop our strategic plan with lots of stakeholder engagement over several months. And so this is what we need to make our work happen, to realize our 4 goals. So community is huge. In our health equity portfolio in particular, community engagement, community-led research is at the core of everything that we do. We bring our research excellence and our research expertise, and our community partners bring the social problems, bring the health problems, and we co-create solutions and try to advance those solutions together. So community is agencies, it's Alberta Health Services, it's other universities, it's trainees, it's all of those people. Partnership is at the core. Those big goals cannot be achieved in isolation of really strong partnerships. And so the O'Brien Institute is absolutely nothing without our partnerships, and all of the work that we do is partner focused and partner driven. Funding, this is a no-brainer. If you want to do really good work and you want to sustain that work, you have to have core funding. And we think we need diversified funding so that we're not reliant on one piece of funding. One of our goals is to diversify that funding so we can continue to do this great work in the long term. We offer several programs and services for our members and trainees. We do internal peer review for grants before they go out. We can connect you with people who have been successful in grant competitions to give you advice on your grant before you submit it. We have catalyst competitions a couple of times per year, a couple of different envelopes. I encourage you to look on the website. You can get a small amount of money, $10,000 to $15,000 to jumpstart a project, do some really good work, and then use those findings to go after some bigger grant opportunities. And lots of other things, mentorship and lots of connections. If you have a research question, you're looking for partners, please reach out to someone on our team and we can connect you to people who are like-minded and are working in the same space and help you foster some of those collaborations and relationships as well. So is that it for me, Jamie? That's it for me, and over to Jamie.
I just wanted to take the opportunity because I realized Tom's last slide when he mentioned the 3rd bullet about the innovation ecosystem. That's a perfect opportunity to advertise our October 11th event on social innovation. So look out for that. Okay, as administrative director, I get to own this goal of operational excellence. And as we mentioned, we learned a lot of interesting things from the strategic planning exercise that we did, and which included member surveys and consultations. And so from that, we summarized this goal of establishing organizational culture devoted to professional knowledge, continuous improvement, and intellectual integrity. And then we split that down into 3 areas of focus. So we heard that we need to continue offering and improving the support programs that are aimed at research excellence. And we know we need to keep trying to understand and address what you're looking for in membership. What can the Institute give you that you need and you don't already have, since it's a, a voluntary organization that we have going here. And then bottom bullet, but top of most people's lists, as we talked about, is the idea of money is the bottom line. As the Institute, we need to keep striving for external contributions to the Institute and then strategically investing those contributions towards members' research activities. Next slide, please. So the programs and resources Katrina mentioned. Keyboard. It's me. La, la. Okay. Yeah, so Katrina mentioned some of these. These are the resources and programs that we heard were most appreciated. And we're starting to work through each one, getting member input and trying to make improvements while also being thrifty during these challenging fiscal times. So as mentioned, the direct funding opportunities we have now is the second to last bullet, the catalyst funding opportunities. And these are now twice yearly competitions, and there's a deadline coming out October 1st. So hopefully you've seen the emails about that. Look on the website for that. And we also do still participate in the twice yearly Cummings School of Medicine matching program to support postdocs. And that deadline is coming up November 1st. Those opportunities. And then as Tom was mentioning, besides these support programs, I think the most valuable thing that the Institute offers its members is this community or ecosystem of multidisciplinary cross-campus and cross-sectoral colleagues working towards this common goal of better public health research excellence. And so in the bottom right there, you'll see that honeycomb kind of thing. That's a relationship framework that we've developed to represent the different kinds of, they're usually topic specific internal and external groups that we interact with. So, in the centers we have W21C, the Brenda Stratford Center and the New Health Policy Center. The research interest groups include people like, GRIP, health economics, health geography, UCBC. Some of the alliances are the Center for Health Informatics, the HCA unit, Matheson Center, One Health, all these internal, external groups. And then cross-cutting to those on the left-hand side, cross-cutting to those topic-based groups, we have these portfolios that are based on, research approaches or assets. And we have members leading each of those portfolios within a members operation committee that we used to call an executive center, an executive committee. And so within that committee, we're trying to ensure that the programs and events that we are delivering are what members want and need. So again, the importance of the ecosystem. And that is me. Thank you.
All right.
Oops.
All right, so I am excited to sort of reintroduce you to the Community Health Sciences Strategic and Action Plan. And I'm going to introduce sort of parts of it, and then Fabiola is going to join me here on behalf of the associate heads who are busy teaching today. So I did just want to pause for a moment and thank everybody who generously gave us their time. It's a long list, and we would not be able to reflect sort of the breadth and depth of thinking in this plan, and I think have as much energy as we do behind it without all of the generous time that these folks have given us. So big thank you to everybody there and others who spent their time at Department Council or different opportunities telling us their feedback. So our mandate was to develop a 4-year strategic plan for the Department of Community Health Sciences, which ran from April to March 2025. And just like Tom kind of set out where they stand in relation to the other institutes, we also placed ourselves within this broader framework of O'Brien being our closest and deepest partner, our favorite too. And of course, we sit within the Cummings School of Medicine, the broader University of Calgary. And you might notice that both of the timelines for their strategic plans have ended. So as we started this work, we were very aware that we're a little bit off sync with those broader institutional plans that we do need to align to and contribute to. So we view our plan very much as a living document and are taking the time on a regular basis to sort of check in with where the school is, check in with where the university is, make sure we're still headed where we want to go and it still makes sense in that broader ecosystem. So our plan on a page, as Tom said, you know, you start talking about strategic plans and people fall asleep. For me, this is like so energizing. I could have like this and a cup of coffee and I'd be set forever. But just to draw your attention to two really, the biggest points on this page, I think, are our North Star, which is healthy societies. And I view that as my guiding light. That is where we are headed as a community. We will never get there. It's, you know, always something that will be aspirational to us, but that is where every action we take should be taking us towards. The other part is our strategic focus areas, and we have 3 of those: research, education, and service, reflecting the 3 areas of activity of a faculty member and a university. And so our research statement is really around pursuing meaningful research. Our education statement is around reimagining education. And our service statement is around creating with communities, with the emphasis on with there. And then underneath each of those, we have strategic priorities that we've worked very hard to turn into an action plan that Fabiola will walk us through. So bringing this all together in a beautiful visual, we sort of are surrounded by our values, which are the University of Calgary's values, and those sort of work around all of our work. So we view our 3 kind of focus areas as coming together to achieve our mission of advancing health with communities. And with that, I'll invite Fabiola to come on up.
Thank you. All right, hello everyone. I probably don't know most of you except for the front row. So I'm Fabiola Appreciation. So here I'm presenting in the role of Associate Head for Education, but also representing the Associate Heads for Research and Service, who could not be here, and Associate Dean for, or Associate Head for Equity, Diversion, and Inclusion. So just gonna move that forward. Great. So I get it, strategic plans can be a little bit not so exciting, but action plans are totally my jam. So this is where I really love to be. We've moved into our action plan. We've done some engagement with our CHS community members over the past year or so through various different modalities, and we've come up with this action plan as with Fiona as the lead and the other associate heads. Here we have these overall objectives that actually reflect our core activities that span all 4 dimensions. So research, education, service, and our EDI initiative. And that you'll notice, it's probably hard to see on this graphic, but we tried really hard. There's a wave here that represents the EDI kind of focus of all of our work. And so that's intended to illustrate that our focus is really to bring EDI into the research, into the education and service domains, rather than think of it as this other siloed thing that happens on the side. So we're really looking at integration of EDI throughout all of that. And recognizing too that there's a lot of integration and crosstalk across research, education, and service domains as well. And so that's where we have these overall objectives, which reflect our core activities. So, you know, one thing we all want to do is define what it means for CHS faculty members to reimagine education. So, and not just faculty members, I should say, we want to engage with students and all of our learners as well. You know, what does it mean to have research impact? What kind of impact are we looking for? So trying to create that shared understanding of what our goal is with these actions. So that's one piece of engagement we're hoping to undertake. Well, we also want to audit what is already happening in the university broader. So I love the visual that Fiona already presented of where CHS sits in this broader ecosystem. We don't want to have to reinvent the wheel, but sometimes it means that we just need to reorient CHS faculty, staff, and students to what already exists and make that more accessible, because there are a lot of resources across campus. So we want to know what already exists, what's happening within our department, what's happening outside, and how we can create those synergies in a way that we don't have to then create a whole bunch of resources and then curate the resources, right? So in my educational kind of portfolio, I'm really interested in what the Taylor Institute offers in terms of teaching skills, professional development in the area of all forms of education. But there's a lot. But there are a nice subset that we know are really great workshops that apply to the kinds of teaching and educational activities that are undertaken by CHS faculty and staff. So that, hopefully we're going to be able to curate that for the department. And also creating this environment of sharing opportunities, right? I think that's something that we do really great at sharing our research. So on that front, we're probably not as much work to do, but we don't do very well at sharing our educational approaches and the teaching challenges we have in the classroom or in our supervision of graduate students, for example. That's particular to CHS. So we want to create those opportunities around the challenges of education and service and even research, and creating more opportunities for us to engage with each other, just to enhance kind of our sense of community, and also to create those synergies across individuals so that it doesn't feel like we're all so siloed and alone. And then lastly, what are those, we all had to come up with a tangible action. Like what's the first thing we're going to undertake in order to kind of pursue the fulfillment of these big objectives. And this slide is very small. I can barely see it, but this is just to illustrate that we've got the objectives on the side here, and then some individual kind of more specific actions in our plan for how we are going to achieve or meet these objectives by 2025. And in our first year, we have this initial plan. So that's what I wanted to highlight for today. In the research arena, really thinking about how we can support CHS faculty, staff, and students in articulating what their research impact is. So creating a research impact statement. Because we're asked for that all the time, but not sure everybody's really comfortable in doing that in a very effective way. So that's one of the goals in that domain. In education, we're working on a stackable graduate certificate, which I'm sure you all know about. So that's a project in progress in that educational realm. So bringing in a new dimension into CHS that will hopefully create synergies across programs. Creating guidelines for what it actually means to have authentic engagement with communities. So oftentimes we think of communities as being the community outside of academia, but we have lots of communities within our institution that our members engage with in under that broad umbrella of service. And so thinking about what the guidelines around authentic engagement with that is representation of CHS across campus as well. And then lastly, creating EDI guiding questions. So this is a big undertaking under our EDI portfolio, thinking about how we can support faculty, staff, and students in CHS who are looking to grow and move this EDI mandate forward by creating kind of some guiding questions to help people grow in that area, because we're all in a very, I think, a very broad spectrum of development in understanding and undertaking EDI kinds of activities and initiatives within our work. So that summarizes very, very quickly what we've been working on and are ready to implement. You can see that there's opportunities here for continuous feedback. So for those of you online, I think Mariko could probably provide that link for the survey. And then for everyone in the room, we'll try and get that emailed out to CHS membership. It has been emailed out before, so this has existed for quite some time. Haven't really gotten a ton of feedback, so if there is some feedback out there, we'd love to hear it. But with that, I'm turning it back to Fiona so we can all mingle. Is that right? Or am I taking this? Or Mariko? Okay. Great.